Hey, welcome back to the Dr. Jim Cares podcast. My name is Dr. Augustine from Head to Wellness, and today we're going to be talking about herniated discs. In my 35 years of practice, I've seen many disc herniations over the years, and we're going to be talking about how do we solve a herniated disc without surgery. And we're going to specifically be talking about lower back disc issues. So today I want to tell you a story about Joe. Joe was a young man who had a major disc herniation. We'll say Joe was 30 years old. He injured himself at work, and he would actually come here because he was getting no results at his medical doctor. So he came here, and we specifically did amazing things with Joe. He never did have back surgery. He's still just fine today. And so I want to start first by describing what a disc herniation is, because you've heard the term slip disc, herniated disc. So disc herniation is the technical term, and there are two types. There's a protrusion, bulge, or there's also a prolapse. Protrusion and prolapse are the two types. Prolapse is literally you've had so much force and load that it blows a hole through the disc material, and all that disc material comes from inside of the disc out into the spinal cord, hits the nerve roots, enter the spinal cord, and big problems. So some anatomy. The disc is the spacer between each of your vertebrae, and the height of your disc partially makes up the size of the holes where your nerves exit on both sides. So imagine disc is this height, holes are like this. What if you wear the disc down? Holes get permanently smaller on both sides. Then if you're tilted or rotated, it can affect one side more so than the other, and people can end up with sciatic pain or pain down their legs, one leg or the other leg. Also, within the disc is made up of fibrocartilage. There's an annulus fibrosus, that's these fibrocartilage tissue that actually angles at 45 degrees, and the next layer in goes 45 degrees the other way, and in and in. It's really tough stuff. And right in the center of your disc, you have something called a nucleus pulposus. Nucleus pulposus, it's like a jelly. And these discs, like I said, they're the shock absorbers and are the spacers between your vertebrae. Since we're speaking about your lower back, you have 5 lumbar vertebrae. The lowest disc, the lowest segment in your lower back is L5, has the largest nerve roots, the smallest openings, and yet your L5 takes the entire weight of your upper torso. So if you're typically going to have a back problem, many times it's going to be your L5 disc that's going to be an issue. So here is the mechanism. The mechanism is, and this is what I like to call it, I call it the ice cream sandwich effect, which means if you were to take an ice cream sandwich, y'all know what that is, and you squeeze one side, the ice cream bulges out the other side. So imagine the ice cream is actually the disc, and the cookie above and below are the vertebra above and below. The vertebra above and below. So if you misalign the position of those vertebrae, then what happens, it can affect your disc, load the disc, and the disc can then bulge out and hit your lateral, the nerves exiting both sides of your spine. Typically it's one side or the other, or it can hit your spinal cord, or a combination of those things. Hence, lots of pain, lots of symptom, that sort of thing goes on. Now let's go back to my patient Joe. Doctors like to begin to do surgery when they do an MRI on a lower back, and when a disc is actually herniated 4 millimeters or more, they like to start beginning surgery. Joe's disc herniation was 15 millimeters. It was a giant disc herniation, the largest that I've ever seen in practice. So the process is, if you misalign the vertebrae, this can affect your disc. You can start to create so much stress and load that you start tearing through that fibrocartilage tissue, and you get a bulge that can hit hence the protrusion, hit your spinal cord or nerve roots. And then if you have some really quick and swift and a really high level of force, you can create a prolapse, which isn't a good thing. So let me tell you how we solve this problem. And symptoms. You might have symptoms, lower back symptoms. Progressive or immediate lower back pain can be a sign of disc problems. It can include pain down the leg. Now here's a really interesting finding. that I found that with disc herniations is when you cough, sneeze, or you try to go to the bathroom, that excess pressure, you have pretty sharp, nasty pain either in your back and or down your leg. Indication of a disc issue. Another thing that we do as far as a test is we actually will have a person sit and bring their chin towards their chest. And if they do that and they feel pain down in their lower back, that's an indication of a disc herniation, because the only thing that can stick out into your spinal cord and hit your spine, or excuse me, your nervous system there, can be a disc herniation, or it could be bone chips too, unless you had pretty traumatic, pretty big trauma. But when you do that, bring your head down and you feel something in your lower back, there can be an issue down there, can be a disc issue. So what I like to do as far as the evaluation process is we will have people do that. They'll be sitting, they'll bring your chin down forward, and we will have them move it in different positions and see if they can provoke that lower back pain. And if they do, it's pretty solid that they have a disc issue, and certainly we do follow up with other exams. We do imaging testing, we can do order an MRI and really see if you have a disc bulge, disc protrusion, disc prolapse, how big it is, what tissues are affected. So those sorts of things. So if you have a disc problem and it's getting worse, what are the problems that can be going on? Is really significant pain. There's a particular level of pain that people can get to that the only thing that's going to stop and shut that down is really going to be more medical intervention. So sometimes people will go and they'll get an epidural, literally a needle directly into your spinal cord to inject some. A lot of times it's a medication that's called cortisone, which is a steroid to bring down that tremendous inflammation. So you can get to a level of pain that wouldn't be good. You really want to shut that pain down. You might have to shut that pain down and go into ER or something of that sort. We don't like people to have to get there, but sometimes it happens. And still though, remember we talked about the ice cream sandwich effect. Here's the problem currently in healthcare. Chiropractors, which is I'm a licensed chiropractor, don't have the tools necessarily to shut down this problem really well, like solve the problem. Because here's the thing, go back to this ice cream sandwich effect. If you can actually change the position of the vertebra above and below the disc problem, the forces and load that are put on the disc that's causing it to bulge are not there. If you can permanently change the position of those vertebrae and take that stress off the disc is not protruding and hitting the nervous system, and problem solved. And of course, we want to permanently keep those vertebrae back in proper position and moving normally in all directions. And this is what we did with Joe, for instance. We did consult, we did exam, and orthopedic neurological exams, we did X-ray, and this is the difference. The difference is in our evaluation. When we do X-rays, we do a front picture and a lateral picture. We look at structural alignment. Really critical because, again, that ice cream sandwich effect, if the vertebra is really tilted, twisted, and misaligned, it's going to load that disc and therefore bulge the disc out. So what if we can change that and create balance back into those joints? And the way that we do that is we do a series of stress X-rays at some point. Typically, we'll see people twice a week for 3 to 4 weeks to see if we're calming things down. And then once the patient's nervous system and their pain levels and all of that starts to calm down, inflammation, pain, and all of that, the muscle spasm, all of that starts to relax and calm down. Why? Because we're adjusting the right vertebrae the right direction. Called an adjustment, not manipulation. No one likes to be manipulated out there. So adjust the right bones the right direction, putting things back into place, taking pressure off the nervous system there and off the discs. People get better. Then they're more capable of doing a corrective exercise because there's a very deep set of postural muscles that need to be re-strengthened. Otherwise, the vertebrae won't stay where I'm putting it. That's the whole problem. If we can then design a corrective exercise, and how do we do this? To re-strengthen that musculature, the problem starts to go away and stay away. We do a series of stress X-rays. Now, let me tell you about spinal biomechanics. Discovered over 50 years ago, how your spine should normally move, and your lower back moves differently than, say, your neck, as far as the structural mechanics of it. So let me demonstrate I'm going to stand up and show you. When you bend your spine, your lower back to the left side, we take a picture of bending it to the left. Then we take a picture of you bending your spine towards the right side. Your vertebrae, imagine that you have a block in the front part of your vertebrae called the vertebral body. That should tilt towards the side that you bend to. Here's the key. The spinous processes that stick out the back, they're like little fingers, they stick straight out the back. They should move towards the side that you bend to. If you bend to the left, the vertebrae, the vertebral body should tilt left. The spinous processes should rotate towards that left side as well. However, you bend to the right side, the vertebral body should tilt towards the right side, and then the spinous processes should rotate towards that right side. We discover this when we do these stress X-rays. Now, you can't see muscles on X-rays, but you can see the results of how these muscles move your vertebrae. And you'll see one side will work too well, the other side is going to fail to some degree. That's when we can start and begin to design the corrective exercises to then solve the problem so that we can have a person keep their spine where I'm putting it when I adjust them. So we would do this. We would go over their X-rays, compare it to their structural X-rays, and you'll see a really good agreement with those two. Sometimes we'll see, however, an X-ray, the first set of X-rays, the structural X-rays, might be right in the center, but people have lots and lots of symptoms and pain and complaints. Therefore, we may need to go right into doing the stress X-rays as well, because you will definitely see deficiencies. And our goal is to re-strengthen only the weak, damaged musculature so that it catches up to the strong and normal side. And our goal is symmetry of function. You bend to the right, it looks just as good as bending to the left. Joe was awful. Joe's lower back was absolutely terrible. We designed corrective exercises, and he had to do them progressively and slowly, but as he started to do this, I was the only person that could actually keep him out of pain and ultimately solve the problem. His vertebrae, if you can believe this, ended up being symmetrical. In other words, he bent to the right, it moved just as well to the right as when he bent to the left, and the standing still picture was perfectly centered and balanced. No more symptoms, no more pain, and Joe today is probably 50 years old. So we've seen great changes with this process. And this process that we're talking about, this corrective process, is only as good as the person's ability to do these corrective exercises. So when I first see a patient, I describe this, that they can choose whatever they want, because this is not my lower back, this is not my body, it's theirs. You can do temporary relief care, or you can do corrective care. Corrective care is, and I describe this process of the stress X-rays and discovering the real missing link to fixing and solving spinal problems versus not. Certainly the adjustments help. The adjustments put things back into place, and the combination of the adjustment combined with these corrective exercises, the problems will be solved. Even in scoliosis, we see this type of correction occur. So that is the process. That is the process. Misalignment, so much misalignment, so much force and load that can create this disc bulge that just manifests as tremendous lower back pain. Coughing, sneezing increases the pain. Going to the bathroom increases the pain. Bringing your chin down towards your chest can increase the pain. And sciatic pain down a leg. Now, what happens when do we say, okay, you know, this patient needs to be referred out to an orthopedic surgeon? When is that time? And that is usually the time when a person loses, they might have tremendous lower back pain, but they start to lose control of bowel and bladder function. And or they start to get weakness and dysfunction into one of their lower leg. One problem is called foot drop. Typically when you walk, you heel and toe as you walk. Well, what if you can't bring your toe up enough to have a heel strike? So literally your foot starts to flop down and it won't come back up. I've seen that as well. We've actually solved that without having them to go have surgery. But even so, we're very aware that there are sometimes people need to go get that orthopedic consult. And when you start shutting down bowel and bladder function and they start getting weakness and dysfunction into one of their legs or both legs, that's a big, big problem. So we immediately are sending those people to an orthopedic surgeon. And I have some good friends that are orthopedic surgeons, and we work quite well together. There shouldn't be this controversy and, surgeons hate chiropractors and chiropractors hate surgeons. No, it's what's most appropriate for the patient. I like to point that out because there's a guy out there on YouTube that's just trashing chiropractors. He's an orthopedic surgeon. He thinks he knows everything. And the more he speaks about things like this, the more we realize that he hasn't been educated in chiropractic, doesn't know anything about subluxation and misalignment patterns, nor how to fix them other than doing surgery. So let's not tell tales. Let's not bash other people. Let's do what's best for the patient. That's what I would say. So with that, I hope this helps. I hope this helps you. If you have any problems with disc herniations, please let me know. I'd love to help you out. And if I can't help you, I will definitely send you in the direction that can. So my name is Dr. Augustine. I have a comment section down below. Ask some questions. If you want to get in contact with me, you can contact my office. Give me a call at 562-860-3404. Email draugustine@gmail.com. I'm also on social media, Instagram, TikTok, YouTube. So I have a lot of videos there. Love you to follow me there. I'm also on podcasting. I'm also on Google, Spotify, as well as Apple Podcasts. So please subscribe to those. Listen to me there. That'd be great. My name again is Dr. Augustine from Head to Wellness. Thanks so much for watching, and we'll see you all next week.